Stress and depression are pervasive issues that affect millions of people worldwide. Understanding the causes of these mental health conditions is crucial in addressing and mitigating their impact. Here, we explore the top 10 causes of stress and depression, delving into their intricacies and how they influence individuals' well-being. Please hit the subscribe button for upcoming videos. Thank you. 1. Work-related pressure. One of the most significant contributors to stress and depression is work-related pressure. This can stem from various factors such as excessive workload, unrealistic deadlines, and lack of job security. The constant pressure to perform and achieve can lead to burnout, a state of emotional, physical, and mental exhaustion caused by prolonged stress. Employees may feel undervalued and unsupported, exacerbating feelings of stress and depression. Moreover, workplace bullying and harassment can further deteriorate mental health, making it difficult for individuals to cope. 2. Financial strain. Financial problems are a leading cause of stress and depression. Concerns about debt, bills, and the inability to meet basic needs can create a persistent state of anxiety. The fear of losing one's home, not being able to afford healthcare, or failing to provide for one's family can be overwhelming. Financial stress can also lead to strained relationships, further compounding feelings of isolation and hopelessness. The uncertainty of financial stability creates a vicious cycle where stress impacts one's ability to work efficiently, thereby worsening financial woes. 3. Health issues. Chronic illness or severe health conditions can significantly contribute to stress and depression. The physical pain and discomfort associated with health problems, coupled with the emotional toll of managing a long-term illness, can be debilitating. Conditions such as cancer, diabetes, and heart disease often require ongoing treatment and lifestyle adjustments, which can be stressful. Additionally, the financial burden of medical expenses and the fear of mortality can intensify depressive symptoms. Mental health issues can also arise from the side effects of medications or the overall impact of a diminished quality of life. 4. Relationship problems. Interpersonal relationships are a fundamental aspect of human life, and issues within these relationships can be a major source of stress and depression. Marital conflict, divorce, and relationship breakdowns can lead to significant emotional distress. The stress of trying to maintain healthy relationships, deal with betrayal, or cope with loss can take a heavy toll on mental health. Family dynamics, particularly in dysfunctional families, can also contribute to chronic stress and depression. Feelings of loneliness and social isolation, even in the presence of others, can exacerbate these conditions. 5. Traumatic events. Experiencing traumatic events such as accidents, natural disasters, physical or sexual abuse, or witnessing violence can lead to post-traumatic stress disorder, PTSD, which is closely linked to depression. Trauma impacts the brain's ability to process stress and can leave lasting emotional scars. Individuals may experience flashbacks, nightmares, and severe anxiety, making it difficult to move past the event. The lingering effects of trauma can affect every aspect of a person's life, including their ability to work, maintain relationships, and engage in daily activities. 6. Major life changes. Significant life changes, whether positive or negative, can be stressful and potentially lead to depression. Events such as moving to a new city, changing jobs, getting married, or having a baby require adjustments that can be challenging to navigate. Even positive changes can bring about stress due to the uncertainty and new responsibilities they entail. Conversely, negative changes like losing a loved one, job loss, or experiencing a breakup can lead to profound feelings of loss and sadness. The stress associated with adapting to new circumstances can overwhelm an individual's coping mechanisms, triggering depressive symptoms. 7. Lack of social support. A strong social support system is essential for mental health. The absence of supportive friends, family, or community can lead to feelings of isolation and loneliness, which are significant risk factors for depression. Social interactions provide emotional support, practical assistance, and a sense of belonging. Without these connections, individuals may struggle to manage stress and may feel that they have no one to turn to in times of need. The lack of social support can make it difficult to share burdens, receive advice, or simply feel understood and valued. 8. Academic pressure. For students, academic pressure is a considerable source of stress and depression. The demands of exams, assignments, and maintaining high grades can be overwhelming. The pressure to succeed academically can come from parents, teachers, or the students themselves, creating a high-stress environment. Fear of failure and the repercussions it may have on future career prospects can exacerbate anxiety and lead to depressive symptoms. The competitive nature of educational environments can also contribute to stress, as students may constantly compare themselves to their peers. 9. Environmental factors. Environmental factors, such as living in unsafe or unstable conditions, can significantly contribute to stress and depression. High crime rates, pollution, and lack of access to green spaces can negatively impact mental health. Noise pollution and overcrowded living conditions can also be stressful. Additionally, exposure to environmental toxins and poor housing quality can contribute to physical health problems, which in turn affect mental well-being. Feeling unsafe or uncomfortable in one's living environment can create a persistent state of anxiety and stress. 10. Substance abuse. Substance abuse is both a cause and a consequence of stress and depression. People may turn to alcohol, drugs, or other substances as a coping mechanism for their stress or depressive symptoms. While these substances may provide temporary relief, they often lead to addiction, which exacerbates mental health issues. The physical and psychological dependence on substances can create additional stress, impacting one's ability to function in daily life. The social and legal consequences of substance abuse, such as strained relationships and job loss, further contribute to the cycle of stress and depression. Conclusion. Understanding the causes of stress and depression is crucial in developing effective strategies to address these mental health issues. Work-related pressures, financial strain, health problems, relationship issues, traumatic events, major life changes, lack of social support, academic pressure, environmental factors, and substance abuse all play significant roles in contributing to stress and depression. By recognizing these causes, individuals and mental health professionals can work towards creating supportive environments and implementing interventions that promote mental well-being. Reducing stigma, encouraging open discussions about mental health, and providing access to resources and support are essential steps in mitigating the impact of these pervasive issues.